In the Horn of Africa alone, nearly 64 million people are in urgent need of humanitarian and protection assistance. Women and girls are disproportionately affected, facing limited access to basic health care, including sexual and reproductive health services. With over 1 million displaced in northern Mozambique, more than half are women and girls. Conflict, climate shocks, and economic instability have displaced millions across East and Southern Africa. By the end of 2024, the region is expected to host 23.6 million forcibly displaced people, severely impacting communities, livelihoods, security, and access to essential services. In Kenya, the longest drought in 40 years forced communities to migrate further from health facilities. Thanks to a motorcycle ambulance, women like Maria in Turkana County have been able to reach vital maternal health care in time. Community health volunteers like Mark Ebion are on the front lines, ensuring that no woman is left behind. Refugee communities are also at risk. In Kalaboya settlements, community health volunteers George and Queen are promoting safe motherhood, ensuring that refugee women can access the care they need for safe births. These efforts, supported by UNFPA, are transforming lives in one of the world's largest displacement crises. The Horn of Africa hosts one of the world's largest displacement crises, with millions of people fleeing conflict and climate disasters. SRHR must be at the forefront of humanitarian responses to ensure that no woman or girl is left behind, as UNFPA's regional director reminds us. In Mozambique's northern Cabo Delgado province, 850,000 people face displacement due to violence and climate crises. Dr. Zuria Alberto leads a mobile health team, traveling by land and sea to deliver life-saving sexual and reproductive health services. These services reduce maternal mortality and protect women from gender-based violence. In Zambia, drought has devastated crops and deepened food insecurity for over 9.8 million people. Nurse Suvana Sinakaba is part of a UNFPA-supported mobile health team visiting remote communities. Rising rates of HIV and unintended pregnancies, especially amongst teenagers, are a growing concern as young girls become increasingly vulnerable in times of crisis. In Ethiopia's Tigray region, Yemane Mehret was displaced by conflict and gave birth in the desert, resulting in a tragic stillbirth and obstetric fistula. Thanks to UNFPA and the Hamlin Fistula Center, Yemane received life-changing surgery and now hopes to help other women who face similar hardships. Your support makes all the difference. We stand at a critical juncture, a moment where the lives of millions of women and girls hang in the balance. In humanitarian settings where conflict, climate change, and displacements converge, access to sexual and reproductive health services is not just a matter of choice, it is a matter of survival. It is about the dignity, safety, and the fundamental rights to plan and protect one's future. Our work is not just about providing aid, it is about restoring dignity, rebuilding communities, and strengthening resilience. Women and girls in the most vulnerable situations, those displaced, those affected by violence, those without access to basic health care, are counting on us. The needs are overwhelming, but so too is our capacity to make change when we act together.